So, good afternoon. So, today I discuss about the topic is anti-anxiety. So, what is anxiety? What is the think of the anxiety? Anxiety is a disorder like when the certain hormone or certain chemical disturbance between the in our brain. So, that is called as an anxiety. So, now the symptoms of anxiety. What are the main symptoms of the anxiety? The first symptom is the mania, and the second symptom is the bipolar disorder, and the third symptom is the sleep disorder. So, nowadays young age people are suffering from anxiety. So, which drug are decrease the anxiety problem, that is called as an anti-anxiety drug. Now, the first thing is the pathological hallmarks or the pathological biomarker reveals under the anti-anxiety or anxiety. Like that is first thing is the hypothalamus. Hypothalamus is highly present in the brain, and now the ERH. The ERH is an enzyme are come to the pituitary. When the pituitary gland is come, now the adrenal gland come to the adrenal gland. When the adrenal gland is come, when the adrenal gland secrete the cortisol hormone. So, what is cortisol hormone? Cortisol hormone is a stress hormone. So, when the cortisol hormone, the secretion will be increased in our body. So, when the anxiety or the depression will be come into in our mind or into in our body. Now, that is the main thing of the main important thing is the biological or the biomarker of anti-anxiety drug. Now, the classification of anti-anxiety. So, which drug are decrease the anxiety? So, that is called as an anti-anxiety. Now, the classification means which medicine are used in the anxiety problem. Now, the first thing is there the classification. The first class is the barbiturates, and the second class is the benzodiazepines, and the third class is the non-barbiturates. So, first thing is the barbiturates. Now, the barbiturates is the divided into the four part. Like the four part means the first part is the short acting. So, which drug means the short acting means the which drug are acting in our body 1 to 2 hours, that is called as in short acting, and the third is the second is the long acting. So, when the drug in our body are intake in the orally or IV or IM, so whatever else, so that time increase the T-half, that is called as an long acting of the drug. Now, the intermediate means the middle of the period of the drug, that is called as an intermediate, and the ultra acting means the very short acting drug, that is called as an ultra acting, or that is the drug example of the thiopental sodium. That is the main thing of the anti-anxiety drug. Now, the third classification and the second classified the drug is the benzodiazepine. So, what is benzodiazepine? Benzodiazepine group, that is the same. Come to the barbiturate, the first class is the long acting, and the second class is the short acting, and the third class is the very short acting. The first class is the long acting, means there is a diazepam or the felozepam, and the short acting means the oxazepam or alprazolam, and the very short acting drug is the midazolam or the alprazolam. That is the main thing of the short acting drug. Now, come to the main thing is to the mechanism of action. So, what is the mechanism of action? Which drug are come into our body or intake in our body, how to work in our body of the drug against the anxiety problem, that is called as a mechanism of action. So, now the first mechanism of action, the first group is the barbiturates. So, what will be the main things? When the barbiturate drug like the barbiturate like drug means there is a diazepam or the midazolam, alprazolam, this type of drug are intake in our body into the orally or IV or IM, like intramuscular, intravenous, this type of things. So, the activation of the GABA receptor. So, when the GABA receptor is activation, opening in the chloride channel. So, when the chloride channel will be operation, I know that when the chloride channel will be open into in our body, the hyperpolarization of the there in the cells, like open the chloride channel in the duration of the GABA gated channel. When they increase the duration of the GABA gated channel, the hyperpolarization itself, that is called as an depression of the CNS, and that is the main mechanism of the barbiturates, and the main drug is the D.Pharm. Now the main mechanism action of the D.Pharm, that is, it is the mainly potentiate on the GABA receptor anti-convulsant target, that is the muscle relaxant, and that is called as an anti-anxiety action. So that is the main thing of the D.Pharm. Now the dose, now the different type of dose is there. The first dose is the D.Pharm. D.Pharm take orally 2 to 10 mg per day IV, and the oxyGPharm, the dose is the 15 to 120 mg per day in orally. Now the very short acting the drug, that is called as an midazolam. Midazolam is the dose is the 0.5 to 1 mg per day. That is the main dose of the midazolam. Now the next is the adverse effect. So what are the adverse effect of in the anti-anxiety drug? The first adverse effect is the allergic reaction, and the second drug is the excitement, and the third adverse effect is the irritability in our mind. That is the main thing of the adverse effect. Now when I intake in our anxiety drug, that is the main thing of the decrease the anti-anxiety because of the imbalance, because the balance of the certain hormone or brain. So that is the main thing of the anxiety drug. So it is the overall complete the class of the anti-anxiety and the classification and the symptoms. So these are the main things. Thank you.